All right, it is now 6 p.m. I'm going to call the meeting to order at 6 p.m. If we'd please stand for the Pledge of Allegiance. Pledge allegiance to the
Flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, we can go to the roll call.
We have Member Rosemary Alanis,
Present.
Treasurer Leticia Gallardo,
Here.
Secretary Anthony Herrera,
Here.
Vice Chair Lorraine Avalos,
Here.
Chairman Matthew Rodriguez.
Here.
Present, thank you.
All righty. At this time, we'll open it up for public comments. This is an opportunity for members of the public, this includes on Zoom, to address the board on any matter related to the commission that is not listed on the agenda. Comments will be limited to no more than 3 minutes. Is there anybody for public comment?
Hello, 1057 Mill Street, Rose Robertson. It's come to our attention, a citizen had came to the city council and stated on the record that we had your former chair who went to some of the citizens here in Selma and stated to them that what qualified under the grants for the Selma Healthcare District Board. With that said, would you guys be able to direct me to where in the minutes did the board approve for your chair to go out and speak to citizens of Selma? And if not, that definitely is a violation of the Brown Act. And hopefully you guys could refer this to your council on how you guys are going to fix this. If she did go on her own, she's up there with a nice smile. So maybe there is a resolution or the minutes. And I know this was the previous board who went. Not sure who she went with, but she did go with someone else. So if the council, I'll be emailing you for the record as well. If you could email me if there is the minutes for that and who voted for that. Also, I just want to state, I pay my property taxes every year up front, and they're very expensive between just our home and our building. We have every right as citizens to state where we would like our taxpayer property tax money to go to. You might not agree, but for us, we have different ways of looking at this board on what qualifies under certain standards. Back when I was the chair for the board, we had many parents come who were struggling, who couldn't have their kids be in certain programs. So with having this healthcare district here and them being able to use the healthcare district to help some of these kids be in certain things, whether it was sports, uniforms, make their self-efficacy, feel good about themselves, it qualifies. Whether you agree or we don't, but every citizen of a nonprofit organization have the right to come here and put a proposal in front of every single one of you, not one person. So I just want to say that. And I also want to say thank you to the new board who are being more transparent. I noticed January 14 meeting before you guys were voted in by the citizens of Selma, the new board, you guys would not put how much the proposals were on the agendas. And I saw that you did do it for this agenda, so I appreciate that. It's nice that the citizens are able to see what the nonprofits are asking for and how much. Thank you.
Thank you. Any other public comments at this time? Any on Zoom? No. Alrighty. We will move on to additions to the agenda. The board may add any item to the agenda upon a 2/3 vote. The board finds that if the board finds that there is a need for immediate action on the matter, and the need came to the attention of the board after the posting of the agenda. Are there any items at this time?
We had lunch at the senior citizens, and I noticed there that their door did not open, some of the people were struggling to get it open. And so I had suggested,
We have that on the agenda.
Oh, you
It's item
do?
number 5, yes.
oh, okay, I'm sorry, never mind.
Anything else? Alrighty. We'll move on to potential conflicts of interest. Any board member who has a potential conflict of interest may now identify them and recuse themselves from discussing or voting on the matter. Any conflicts of interests? Approval of the past minutes. We can take a look at January 14th minutes. If anybody has any corrections or comments?
I make a motion to approve.
Been a motion by Director Alanis and seconded by Vice Chair Avalos. I guess we'd take a whole vote.
On whether or not to accept last meeting minutes, I have Rosemary Alanis has Letitia Gallardo. Anthony Herrera,
Yes.
Avalos.
Yes.
Thank you. Matthew Rodriguez.
Yes. Alrighty, move on to information items. The treasurer's report.
Okay, so as of today's balance, we have 439,187.16 cents. February's balance of 2025 was 461,547.88 cents. We had a deposit reference number 8613468719108,046.14. Check 1703 Leon's Computers, $585.96. Check 1704 Debbie Hubble, timesheet number 14, $960. Check 1705 and 1706 were both voided. Check 1707 Uniquely Yours, invoice number 7165 for plaques, $21.70. Check 1708 Uniquely Yours, invoice number 7181 plaques for $86.78. Check 1709 was for the auditor, invoice number 4995, $1,000. Check 1710 attorney fees, invoice number 494281, $3,726.82. March's balance was 564,796.67. Check 1711 Advantage South of Hanford, the mental health grant, $50,000, the final payment, ID number 940535360. Check 1714 attorney fees, invoice number 495015, $378. And additional information, check 1712 Selma Enhancement Corporation for 3 Lucas devices. It was a grant proposal granted to the Selma Fire Department for $69,645.05. Their ID number is 3115-37679. Check 1713 Selma Enhancement Corporation CPR classes. Also was a proposal grant for the Selma Fire Department, $4,817.97. ID number 3115376779. Check 1715 County Clerk Register Voters Invoice 103 for $451.49. All these checks have cleared. That's it.
Is there a motion to approve it?
Now I have a question.
Yeah.
Check 1707 and 1708 for Uniquely Yours. What did we purchase?
Your plaques.
For
the
what?
name plaques.
Okay.
Ready? If there's no objection, we'll move on to the next item. the Selma Fire Department update on CPR classes, and then also Selma Fire Department update on the Lucas devices.
You guys hear me okay? Daniel Diaz, EMS Supervisor, Selma Fire Department. Just give you guys a quick update. Our Lucas devices, they went to council on 3/18, got approved, and after that, we ordered them on 3/26. We received them on April 3rd, and then we had an in-service training with all of our crews to make sure they're familiar with the equipment. And they went in service on 4/11. We have our truck crew here, and if we have a break later today, I'd love to take you guys out to show you that the machine is on the truck and ready to go and in service to be used today. So they're, it's also on the truck, an engine and another engine across town at Station 2. So that's great to hear, and the crews were super excited to get the equipment, and we're all trained on it, and they should be good to go. As far as the CPR classes, that also got approved at council on 3/18. And we had a little bit of delay setting up classes. We needed to order some supplies, disposable masks, one-way valves, all those things we need to teach the class itself. So we actually set up a class for this Saturday, the 26th, I believe. It filled up in 2 days with deposits. So the buzz is there, and there's another list of like 7 other people that wanted to participate. So due to the delay in a couple months that it took to get those checks processed, I don't think there's going to be an issue with getting all the classes that we initially said that we were going to have done. I think we could probably do those and more. So I plan on doing another CPR class probably in 2 weeks, maybe even less, just to get the public, because the interest is there and they want to show up and they want to do these classes. So we're going to do our best to make up the time, and we will get all those classes that we said we're going to teach done for sure.
Now, did you say those deposits are refunded at the end of class?
Yes,
Back
so
to-
no, if you put a deposit down to hold your spot, once you come to the class, we give you your $20 back. It's just a placeholder. We had some issues last year where people were putting their names down and not showing up, and we could have gave it to somebody that really wanted to be there. So this kind of ensures that everybody shows up that says they're gonna show up. Mhm. Any questions?
Great job.
And so when these classes are given, just because some people were asking,
Mhm.
as long as they pass the tests, they'll be certified, correct?
Correct.
Okay.
We give everybody, it's an open book test. So we haven't had anybody fail yet. So I don't think that should be an issue. And there's options for remediation right then and there. So there is a highly unlikely chance that someone would complete the class and not fail. If not, we're not teaching that good, but I feel like we have the best instructors. So we should be fine there.
Awesome. If I'm not mistaken, the last time that the grant was given, some of the classes were held at Selma High School. Was that the case?
No, so we had high school
Right.
students that participated, and we hosted it at our facility across the street.
Okay.
But we set up a class for high school students that were interested in like the ROP program, the fire program, the EMT program, and the nursing program as well.
Okay.
We picked those students specifically because they want to work in our field, and we felt it'd be a good way to tie in with the youth and get them trained.
Well, and then are we outreaching again with the program to make sure that they know that?
Correct.
What will
We set up a class, we're gonna set up a class specifically for them.
Okay,
And so we don't have like people from the public, we want to give them the most opportunity so they can send as many students as possible.
awesome.
Mhm.
Appreciate it.
Could we have you come back next meeting with data on the Lucas?
Of
How-
course,
How many times it's been used and
of course, not a
anything you
problem.
can share?
Will do.
Great,
All
thank
right,
you.
Thank you guys.
All righty, thank you very much. Now we'll move on to item 4, section 8, item 4, Adventist Health Quarterly Update on Mental Health Initiative.
Right, I'm gonna give an update. The last time we provided an update for Adventist Health. was in January, and that data was from Q4 2024, so end of 2024. This information that's being provided is through Q1 of 2025 of this year. Sorry, I have to look at the numbers because I don't recall the numbers. I'll wait until you can just share it like that, maybe make it a little bit bigger. It's okay. You can click on the next slide. Does it let you? It won't let you? Yeah, yeah. All right, so it looks like I'm gonna be providing an update. Okay, so our licensed clinical social worker, just to remind everybody, she sees patients in clinic and in the ER in the hospital. So the data I'm gonna give right now is specifically for the program reach and patient data for the individual therapy that she provides within our Selma clinic. Since the program started with grant funds, 2024 to current, she has provided therapy sessions for a total of 97 unique patients. Unique patients means that this is her patient panel. These are the patients that are continuing services with her. Out of those 97 patients, 50% of patients are Selma residents. Since the beginning of the program, she has done 488 therapy sessions. So those 488 therapy sessions are for those 97 patients that are continuing to receive services. Since our last update, that's an increase of 114 patients since the last time that we presented. Just to provide an update, our LCSW did have to leave for about a month and a half on a personal leave of absence due to a family situation. During that time, although she was not able to provide direct services, we had other clinical licensed therapists that were providing services to her patient panel. I don't have those numbers, so the numbers are probably a lot higher. We're just not able to identify that. And in our emergency room, because there has been additional training and resources implemented, patients were still being provided with resources. They just didn't have that one-on-one warm handoff from the licensed clinical social worker. So I just wanted to make sure that you guys were aware of that. Since the last reporting period, that's an increase of 14 additional patients that have established care with a provider for inpatient or for outpatient services. An additional data I wanted you to have as well is that since the program started, she has scheduled 672 individual therapy appointments. Now, we know with any medical appointment, not everybody attends your appointment, whether it's, they forgot, they weren't able to make it. But out of those 672 patients that were scheduled, 488 kept their appointments. Her no-show rate currently for Q1 2025 is at 18.9%. Again, when we started the program, 32% of patients were not keeping their appointments. And there's been a lot of different work that's gone towards helping reduce no-show rates, ensuring that those patients keep their appointments. So we're currently at 18.9%. I'm on slide 3. Thank you. You can go to slide 4. Thank you. In our emergency room, we've had a total of 110 ER visits that our licensed clinical social worker has provided mental health crisis intervention. In addition, which numbers we don't have, but in addition to any patients that are hospitalized in the hospital, she also provides services to any providers that request she meet with those patients. And she continues to do the hybrid shifts in the ER and in the clinic. So when she's in the clinic, if a patient presents at the hospital, she's able to go and meet with that patient in crisis as well. And that has continued to be very helpful. Next slide, please. Some Q1 2025 project highlights. So what's happened since the last time that we reported? There's been a few new things that we've implemented. We have improved access to resources. Our LCSW developed and distributed custom resource packets that she created for the staff there in the ER. Our LCSW is not there overnight. She's not there on the weekends. And so she came up with the resource packet that providers and clinical staff are able to still provide to patients that need it so that they don't leave without anything, right? They do leave with an appointment, but so that they have additional resources available to them. Included in that packet are up-to-date contacts for substance use services, for homelessness support. A lot of our patients that she sees do suffer from are homeless. And then the MAP program that's from Selma, which provides case management for homeless individuals, and they focus on Selma residents and Fresno County residents. So that's included in there for them. Also, cross-team collaboration. She continues to coordinate with our substance use navigator that's in Selma providing services to patients. And she has strengthened partnerships with the care coordination team that we have. The care coordination team, what they're in charge of is once a patient is getting ready to be discharged from the hospital, that care coordination team follows up with the patient. So if they don't have a primary care provider established, they make sure that they get established with a primary care provider. If the patient has important follow-up appointments, they make sure to follow up with those patients to make sure that they attend their appointments. They're the connection between getting discharged and then that next important follow-up appointment. So she works very closely with them and the case managers for those patients. Another thing that she implemented is she was asked to do staff education with all of our new incoming nurses. We have a monthly onboarding training that new nurses have to do. And what she did is asked to participate in this orientation, and she delivered mental health education to new nursing staff. She covered best practices for how to interact with patients with who are experiencing mental health crises. And she shared tools and community resources to better equip frontline teams across the emergency department and in the hospital. So it's having an impact beyond just her being present. This is something that is helping our other clinical staff as well. I don't know if you go to the last slide. So since we have launched this program with the funds of the Selma Healthcare District, we've been able to serve 598 patients. And since our last reporting period that we've had 134 patients that we serviced. And we're very grateful for your support for these last year and a half going on to 2 years. And this program is going to have an impact greater than what the funds provided. Because not only are we going to continue to have our licensed clinical social worker working as a hybrid position, but we've also established other processes within the hospital that were areas where we could really improve the resources or the tools that our staff needed on how to, when they come across a patient with mental health services, they have a toolkit available to them and a connection with our LCSW. Another update that I wanted to provide was this program has had such a big impact locally here at Selma that our Adventist Health Organization is looking to recreate that same program at our other hospitals. And that would not have been possible without the funds to help support this pilot project. And so I just wanted to thank you for that and show you the impact that it's had so far.
you so much. We're just really proud to partner with the Venice House to ensure that why we're here on the board is to serve our citizens. That's great, great news. Thank you.
Thank you so much.
And I think a lot of people don't understand the impact it has. I know speaking of myself and kind of monitoring our emergency room and all of the 5150s that come in. And then you see that one person, it could be a 12-year-old that was coming in for suicide. Just to help and stop that from happening. I mean, it's huge for that family. And then all the other patients that come with that crisis, without that help. The impact in the community, whether there be like violence, because they're having that mental crisis they can't control. The impact in the community, violence, domestic violence, suicide. I mean, the impact could be huge for 598 people that were struggling at one time. And then to have that many go through and continue on with therapy is just, I'm proud to be a part of it. I think
Yeah.
everybody should be.
I think so. Thank you.
Thank you. Thank
You're
you.
welcome. And just an update to the city of Selma, Adventist Health did recently hire, I believe, it's been probably about 2 to 3 months, they hired a psychiatrist that sees children. And I know that's something that's not available within our area. So there are those resources that we've added for medication management for patients that need behavioral health medicine as well.
That's awesome.
At last meeting, I think after you spoke, I'm not sure if you were still here. But are you aware that we had put the initiative on, we suspended it for this year? That allowed us to purchase Lucas devices.
Yeah, I was updated and
Okay.
yes, thank you for that.
Hopefully we could work again in the future, but
Yes. Well, thank you so much for your time and thank you to everybody. Have a good
Thank
evening.
you.
Thank you. Alrighty, at this time, I would like to see if any members of the public wanted to speak on any of the information items that came up. I didn't go individualized, but if anybody would like to at this time, any one of the four we just went over. Gotta give the opportunity to anybody to speak on any of those, if anybody would like to. Alrighty. With that, we'll move on to action items. Request from website ad hoc to edit sections on website. For this, it's pretty much as simple as we want to put some of the stuff that comes back to us, such as this Lucas devices and the Adventist Health Initiative, stuff as far back as the track that we helped purchase here in South Selma High School. A lot of the other initiatives that we've done before, we want to add a section on the website to showcase what we've done and what the healthcare district does for the community. I'm not exactly sure, but I thought it would be appropriate to bring that before everybody to make sure that it's something we want to do. Would it be appropriate to take a vote on something like that, or would?
It's agendized as an action item, so if you have a recommended action that you or somebody else can make, and
Okay.
then get that seconded.
Yeah. Oh, that piece is. Okay. We'll do the two separate, or, because it'll be one motion and a separate one. So the first item that that we're coming, or that the ad hoc has come up with was that section. So to add a section on the website, not exactly sure what it'd be named, but just showcasing the previous, I guess, previous grantees, or we'll probably put a cooler name than that, but showcasing the things that the board has done, and the board has, I guess, what the recipients have done with the grants that we've given. Is there a motion for that? Okay. All right, is there a motion to add it's to, I guess the formal motion? Yeah. So the motion is to add a section on the website showcasing, previous grants previous grants, and how they've impacted the community. All righty, and then, so we'll take public comment beforehand? Yes. Is there any public comment on this? No? Okay. Is there any board discussion?
I think I might have some pictures. I might have from back, a lot of the stuff that's been done, so I could get it to Joey if it's still there.
Okay. Yeah, I mean, if anybody else has any other photos like that, of course, it'd be awesome to send it.
It's a lot. It's a lot of
Yeah,
stuff.
there's quite a few. If there's no other discussion, we'll proceed with the vote for that one.
Or I didn't get who motioned to
Letitia first, and then,
second.
the second by, Avalos.
So we have Rose Alanis,
Yes.
Ricardo,
Yes.
Anthony Herrera,
Yes.
Lorraine Avalos, and Matthew Rodriguez.
Yes.
Question on that. It says it's request website ad hoc to edit sections. We specifically talked about recipients, but Letitia, you talked about financials.
That's another,
Yeah,
Would
we
that-
discussed at the last
Does that have
meeting.
to be separate?
they're
It
two
says,
separate items,
says
so,
edit sections.
I was an assumption that it was just gonna be putting financial reports in the year and then the financial report. And then you click on it and
That'd
you can
be-
see the report.
that would be adding items to a section. So we're, right now, if we go on. We're just, it'll just be adding our financial statements rather than just our financial audits. So right now, if we look, it says we have our financial audits on there, for every year. But it'll be adding our actual financial statements to the website, not just the agenda minutes. I just didn't want to take them both at the same time since they were kind of not the same in nature. So the next one would be, you said back to 2014?
I have back until day one when, but it's not I wasn't the treasurer at the time, so I have 2014 to, present, today's
Okay.
financial report.
So
Can this vote approve both those sections?
Yes.
we just
Since it's
approved the
not
first
on-
one.
It's, where's the financial adding it on?
So it's two different sections on it's bringing up the different sections that we wanted to add. So I didn't want to put them we couldn't take them as the same vote because
Why?
technically it's two different sections of the website. So the first section that we're adding would be the one that we just took the vote on. And then the second one is not necessarily a whole section, but we're editing the section to add our financial statements.
Can we just approve it now and then you guys don't have to bring it back to the board later?
That's what we're
That's what we're doing.
approving.
Yeah, my hope is that someone would move to allow us to add those to it. Like to,
I'll make a motion to add that and the financial report so people can see all the financial
Yeah.
reports.
okay, so the motion is so we're clear. This motion is to add financial reports from 2014 until now to the website so that, so they're on our transparency page. Is there a second?
Second.
Davilo seconded. Public comment? Nobody? Alrighty. Vote.
Add the financial statement. I have Rosemary Alanis,
Yes.
Gallardo,
Yes.
Anthony Herrera,
Yes.
Lorraine Avalos, Matthew Rodriguez.
Yes.
All right, pass. Thank you.
Alrighty. That's it from the website, correct?
Yes.
Alrighty. Any other comments from up here regarding the website? Alrighty, we'll move on to action item number 2, legal counsel RFQ ad hoc report and further actions. So our RFQ, we initially met and, we kind of went over what we wanted to get, what our goal was. However, we basically went out and said, okay, we're gonna go figure out the firms or anybody that we wanted to reach out to. After we had that list compiled, actually it was we had a suggestion list, went through those, selected the ones we wanted. I was directed to, I basically said, hey, we'll send these out. In that, it was the time that I was going to send it out, it was a little too late to do that before this meeting. But I also had another question for our legal counsel here. My question was, so just so I understand, the reason we're doing the RFQ was because Ken is moving on to another position, correct? Or was it the firm was, or I don't know exactly why.
No, but I can give you an update. So as most of the board is aware, Ken Price in our office has been legal counsel to the board for a while now.
Yes.
Starting a few months back, though, it became apparent that there was a scheduling conflict for both Ken and our office with regards to covering these meetings. And so that was the impetus for the issuance of the RFQ. But as you just mentioned, and I can inform you today, some of you already know, Ken Price has accepted a position at Valley Children's Hospital, and he's going to be leaving our firm. And so he will only be at the firm for a little while longer before he is no longer a member of the firm.
Okay. With that, are our only options to find new legal counsel elsewhere? Or were we able to request, or like, because I'm asking because I mean, I like you and I have no problem with you doing this, is the thing. It's just, I don't know where we go from there.
Well, our advice, we helped with you to get that RFQ in place and out, but it sounds like has it not been issued yet?
No.
I'll have to talk to my firm's administration as to whether or not we can. The last time we analyzed this, we didn't have it was a scheduling conflict with Ken leaving now. That doesn't mean that that's changing, but I'm happy to talk to my firm administration and get back to you.
I'd really love that, yeah. You've been nothing but good to me so far, and us, so. I guess with that, if any board input on that matter?
Good.
No specific action at the time, no. We still have the RFQ if in between now and the next meeting, you reach out and say, no, we still are able to, we have the ones that we're prepared to go to send out. But, to do it, yeah. Okay, so, we'll just, if so happens, we'll just keep going on, yeah. Sounds good, so no action on item 2. No objection, we'll move on to item 3. Proposal request from, City of Selma for funds for summer community swim program in the amount of $8,000.
Hello, everybody. Good evening. My name is Liz Fletcher. I'm here representing the City of Selma Community Services Department. And so what you have in front of you is a request for $8,000 for our summer community swim program. But as you have probably seen already, there is an attached email on there that I sent to your administrative assistant. Yes, Miss Debbie. And so I kind of just wanted to provide an update and kind of advise on how this grant is going to be shifting a little bit if I cannot resolve the current issue that I'm going through right now. And so The summer high school pool will be open this summer. The issue that I'm having or running into at this time is the company that we normally contract for the lifeguard services and the oversight of the summer high school pool decided that they would not be coming back and will not be providing those services for us this summer. And so at this time, we're kind of at a standstill because we were not prepared for this, obviously. And so I do not have a lifeguard job description within the city. And so all of those things would need to be developed within about a 5-week period. And so I'm kind of running out of time. I've been in contact with some other aquatic professionals in the area, asking for advice, seeking connections on, a different company that we could potentially contract out these services to. And all my leads are kind of going nowhere at this point. And so, again, kind of at a standstill. And so what I had kind of mentioned to Miss Debbie was that we are looking to still provide something for the youth this summer. And going back with the pool, we are still looking to partner with America Kids Swim to provide swim lessons, not lifeguarding, swim lessons for the community. And so that will still be an option at the Selma High School pool. The thing that is going to be affected is going to be the community swim program that normally takes place on Saturdays and Sundays. And so that's kind of where our issue lies. And so within our Sparks department, we decided that since we may not be able to offer the community swim program, we were interested in offering a different program outside of the Salazar Center. And so within the Salazar Center, we ran a pilot program a couple weeks ago called Sparks Club. Sparks Club is basically a hangout club where youth from our community are able to drop in, participate in recreational activities, and have just a safe space to recreate. Our goal is to do this Sparks Club 3 times a week. Once school is out this summer, at a drop-in basis for our community. We would utilize the new playground equipment that's out at Salazar, the splash pad that's going to be up and running this summer, along with the building before the Boys and Girls Club, utilize that building in the afternoons. And so per my email, my request pending whether I find a company that I can contract with, if I cannot get that to happen for this summer, my goal is to still request the $5,000 micro grant through the Selma Healthcare District to run Sparks Club. And my intention with that is to purchase some crafts, some equipment for the kids, and to be able to provide a healthy snack during the activity time that will most likely run from about 8:30 in the morning to about noon. So that is my request at this time.
Do you have any input from the board?
So no swim agency, lifeguard agency is willing to come and do the swim program? Because that's what the request is for this swim program.
Correct. So the company that we work with, like I said, the company that they contract out is not willing to come out this summer. All the other local agencies in this area hire their own lifeguards within and manage their own pools. And so we're kind of at a standstill because that is not something that we've done for years. I can't tell you how long it's been since the recreation department has managed the pool. And so I've been here for about 6 years, and that we've always contracted out.
I have a question.
Yes.
Okay, I was born and raised in Reedley,
Yes.
and we used to go to the swimming pool all the time. And they used their swim team, members of their swim team as the lifeguards.
Right.
You can't do that here?
So in order to do that, we would have to go through the hiring process and the certification process with them. And within this 5-week time span, I don't believe that would be feasible. That will be my goal for this upcoming year. And so those are conversations that we are having now in order to prepare for the next fiscal year. Since we're going through our budget, part of that conversation is going to be updating the job description and allocating those positions for the upcoming summer
How about
2026.
The city, has the city anything to do? I mean, have you gone to the city and asked them for monies too?
The city of Selma?
Yeah, city council?
Oh, no, I have not requested that at this time.
So the pool at the high school is complete, but it's not going to be used for the regular program that we've always granted for.
I cannot vouch on whether it is complete at this time. I just know that it was supposed to be, done at some point this month. I'm not 100% sure if it's complete
But
yet,
where are the
but
kids supposed to swim?
swim lessons will still be offered. It is just the community swim program will be affected if I cannot find lifeguards. Or a company to contract the lifeguards for me and manage the lifeguards.
Liz, to kind of clarify, so the same company that used to provide that service isn't, but they will still provide swim lessons.
So they are able to provide the swim lessons, but they contracted an outside entity called Top Guard to provide the lifeguards and the pool manager and the safety equipment. And Top Guard, the company that would normally do it, decided not to come back. America Kids Swim is still willing to work with us to provide the swim lessons, but they are not able to provide the community swim portion of it. My understanding was staffing.
Okay, so for that, it's just the community swim portion that the lifeguards would be needed for? Or will the swim program not, will cease even if or the swim program itself will also not be
So the
running?
swim lessons will take place. It is the community swim program that happens on Saturdays and Sundays that will not be available unless we can find a company to contract those services out to.
So the pool would be closed on Saturday and Sundays.
Yes.
Um,
Trying to look for a lifeguard agency that might want to come out.
That's currently what I'm
Because
working on.
There's going to be so many kids that are going to want to swim and really, really need that for the
I
kids.
agree.
Was there any comments from the public? Yep.
Scott Robertson, 1057 Mill. We had a city budget meeting today, and we talked about this. This came up. Director Fletcher discussed the situation. So just to give you a little bit of background, been around since 2012, so I've been around since the beginning of this. This was Mark Sutton, the superintendent of the school district, who came in and said, you know, we would love to partner with the city in 2013 with the pool. And the city said, great. And, you know, the healthcare district, the city had helped fund the pool. So, you know, it was a good partnership. And the city needed the operating funds at that time and partnered with the healthcare district for that grant to open the pool and to provide the maintenance. The school district in 2013 to 2023, minus the COVID years, provided summer swim for not just kids, but also for the disabled and also for elderly. There are lanes for their disabled lanes, and therefore there are lanes open for elderly as well. So this has been a real blessing for our city and for our youth. And there's always been like an entry fee of $1 or $2 nominal just to encourage that buy-in. So the person who provided the all-important lifeguards, that's been the key. That's been Lori Klatt, Swim America. I guess it's a new name now. But I was in touch with her later this afternoon. And so she is scrambling. She is going to try to find something. So I don't know if your board can provide funding contingent on this, you know, Lori finding lifeguard solutions, but she realizes how important this program is. It saves lives. Instead of kids, you know, learning how to swim in the ditch, they learn how to swim at pools. And they go to the pools, and it's good recreation, and it's good. This is a really good program for our Selma youth. So I don't think the decision's been rendered yet. I think Lori, the director of that program, knows how important and vital to the health of Selma youth and elderly and disabled this program is. And I know that she's going to work on it.
I have a question for Mayor Robertson. Thank you. So you guys had your budget meeting today. Was there any Measure K money for for the recreation?
We have a pre-budget meeting today, and I should have said that, pre-budget. And Measure K is going to fund, it comes from the TOT and it funds the Selma Arts Center and it funds the Pioneer Village. So it doesn't fund the pool. It never has.
Yeah.
It's never funded summer swim. Quite frankly, the healthcare district has always
Right,
stepped in
right.
for that.
Does it just funds those two entities or does it fund any other children's recreation?
At this point, it funds mostly those programs, but it can be used to fund other programs, but it was specifically allocated by the voters for that.
Okay,
Measure K for kids.
right,
Right.
right. Okay, thank you.
Thank you.
I've got a comment. I know this is a really popular program, has been, the mayor mentioned since the beginning. And I do know last year we allocated an extra $2,000 to cover entry fee until that was used. So I know we went through that pretty quickly. So I would hope that we would vote on, like Mayor said, contingency, that we do get that in place. And what I would say is if it doesn't, the other part of this with your Sparks program, to me, it doesn't have enough detail of what the money would be used for, how it would be allocated. It's too broad for me to say I would be in support of it. I support having the kids busy. I think that's great, but it doesn't have enough detail of what that money would go towards. So I would be in favor of contingency on the pool plan. And if we do, let's say, go towards Sparks program instead, possibly a special meeting just for that, so you don't have to wait until the very next regularly scheduled meeting. And then from now until then, it would give you a chance to get some of that data together.
So we're gonna table it?
I would
We
say,
still have public comment.
Make a motion on that first
We
part
still
of
have
that, the
people want to
contingency.
speak.
Yeah, you mind if they speak first?
Yeah.
Alrighty.
Stella Ramirez, Selma, California. I think it's really important for the kids to have a swimming pool here in Selma, because a lot of times they do go to the lake with their parents and unfortunately things happen. There's drownings every year. So I think it's really important for them to learn how to, to swim. My question is, have you tried like connecting with other cities like Reedley, Kingsburg, to see if their lifeguards could come out to Selma, maybe part-time? And that way, teach the kid, take care of the kids here in Selma. Would that be possible? Is that something that has been looked at? Thank you.
To be looked by her.
Why not say that, Liz?
That's my next plan of action. Yes, you read my mind. Oh, yes.
1057 Mill Street, Rose Robertson. Yes, we've always been just huge fans of this program. I know we had lunch with Zanoni, Sheriff Zanoni, and he stated very clearly that a lot of kids are out there drowning. And if there's anything any cities can do is keep those pools open. It keeps the kids here safe, swimming safely with, obviously with seniors and other kids as well, to have our swimming program in place. And I think when they do reach out to Kingsburg and other towns, there may be kids who are licensed that will qualify in that. So I like the fact that you did allocate an additional monies for them to have the first entry fees, freed up for the kids to be able to use that until that's gone. Maybe just allocate another certain amount for lifeguards if she does find them immediately and they're able to use that. Now, if nothing comes about it, I agree with you, bring it back and then put the money back and then maybe come back with another program that has more information to be able to prove that. Thank you.
Okay. Ms. Liz?
Brian Ramirez. I just had another suggestion right now. Maybe social media, because I'm pretty sure this would get posted online. parents would be scrambling, how trying to help. Maybe there's somebody out there that has a certificate and CPR class that can also volunteer, maybe help, because I'm sure if parents find out, they're gonna be devastated for their kids. Just like everybody else has said right now, there's unfortunately there's drownings with summer coming along. People do want to go to the lake. People do want to go, swimming just to stay cool. So this would be a great opportunity to have the pool open, and hopefully somebody can step up to the plate. Thank you.
Thank you. In your original proposal, so the only issue that we also would have with the second part is that, to be transparent with the community, it wasn't on the agenda, so the community would have to see first what it was about. So we couldn't necessarily change, cases
absolutely.
yet.
Yeah.
We would definitely have to have a special meeting. But for the, proposal, presented, is the amount of the lifeguards, the cost of the lifeguards in the $8,000 that you requested, or is it?
Correct. So what I did was, the previous year when we, requested the funds, I believe we requested about $7,200, and that was to cover the lifeguards. And so I added a little inflation clause on there, anticipating that was what the cost was gonna be, knowing that, if it didn't cover the full cost, that I would, look within my own budget to kind of, help, with the remaining balance of that. And so that's kind of what we're looking at right now, yes.
And this 8,000, does that include the free entry fee for the addition? No, this is just
No,
straight, okay.
this is just straight for the lifeguards.
To run the program.
Correct.
This one, okay.
Last year, didn't we allocate 10,000? I think.
I believe
Goes
so.
up to 10, yeah.
10 total.
2,000,
It was in 2003, if I'm not mistaken. We didn't
we
have
we
a
didn't
swim
have a swim
program
program
Right.
last year,
So
but
that
due
was
to the
right
program
before.
being under construction.
Yeah.
Or
and
the swim,
I think 1,000 went for free entry until
Yes.
it ran out, and then I think we added another 1,000.
So my
We would,
next
we
goal
would,
here.
we would like for the citizens, we really want the swim program to run.
Correct.
So we would like for them to be able to go and access it for free until that money runs out, so that they can go there to swim.
Yeah,
Correct,
I
and
think
so-
I think a good way to do it would be, if the board, if someone, or if a board member would make a motion to basically, so I'm guessing it's gonna be a little more than $8,000, for these lifeguards, just because everything's going up. But a blanket cost up to $1,000 to, up to $10,000 to provide the lifeguards. And then once that invoice has been paid, anything remaining up to 10,000 for use for entries for the rest, or for the program itself. Is that something that somebody would be able to move?
I'd make a motion to do that. We'll put it up to 10,000 to assist. It's a good program.
Does everybody understand how that works?
We did it, we've done it before.
So the motion, is from, Letitia, and then, is there a second?
I'll second. Contingent on,
On finding
lifeguards.
lifeguards.
Yeah,
Yeah,
basically.
my next plan of action is to contact, possibly Kingsburg, Parlier, and, Fowler, since they do normally run a swim program themselves. So
Okay, up
that
to
is my next plan.
$10,000
Okay,
max, right?
perfect.
Yes.
On the program, we have Rosemary Alanis,
Yes.
Joe,
Yes.
Anthony Herrera,
Yes.
Lorraine Babalos,
Yes.
Matthew Rodriguez.
Yes. Alrighty.
Good.
Mhm.
Nobody was
Um,
online. I forgot to check anybody online.
Yeah, and I think you just missed me. My guard certification just expired, so. We'll move on to item number 4. Proposal request from Exceptional Sports for Youth with Needs, ESYN, for a variety of sports registration fees for youth with disabilities in the amount of $4,975.
Good evening, members of the board. I would just like to take a brief moment and tell you a little bit about what ESYN has been up to. This August marks the beginning of our 9th year serving residents here in Selma that have disabilities. This year, we have been more out into the community here in Selma, going to schools, carnivals, parent resource nights. We have also participated by Selma Police Department asked us to participate in their trunk or treat this year, which we did. And we have also we have our annual Breakfast with Santa and the Golden Hour Salon here in Selma, along with Plaza and Company, hosted a pop-up event for us at Selma Pioneer Village, where we had 73 toys donated by the mostly citizens of Selma. And that went to kids at our Breakfast with Santa this year. We were also invited to go to Kids Day at the Fresno Fairgrounds, where there were kids from all over the valley, including Selma. And we also started offering a scholarship last year to Selma High seniors.
Nice.
So we are asking the board for monies for our upcoming year to sponsor Selma kids in these activities. Soccer, indoor soccer, bowling here at Freeway Lanes in Selma, horse therapy, which is at Spirit Horse Connections in Kingsburg, paddleboard surf camp, which is in Morro Bay, and the dance and aerobic classes in Fowler at iDance. And these monies are for Selma residents only that we're asking.
A good program.
Any questions from the board? Members of the public, any questions? Comments?
I just want to say they really do reach out to the community when they are trying to fundraise. They did a really great job this year. I believe Scott played Santa this year at the Pioneer Village, and we did help collect a lot of those toys. They did a really good job. The whole community got together, collected tons of toys. They're always out trying to reach out. I think they've reached out to me a couple times to try to donate, and unfortunately 10 other people beat them to it. So it's just, I try to be fair throughout the year, but they definitely are not just here all the time to try to get money from the healthcare district. They are definitely out doing all kinds of other fundraising, and the community's very involved with them. So they've been doing a good job on that end. So I do agree that they should be able to get this funding to help them. There's a lot of kids, and they do a lot of their fundraising and pictures and everything on their social media. And you do see a lot of kids, and they seem to be enjoying themselves with their parents. So it would be appreciated. Thank you.
I do have a question. I know that our area does include parts of Parlier. Do you have any kids from that area at all?
No, we had one family, but they're no longer able to participate.
Oh, okay. Just,
All from Selma now.
okay.
As Rosie was talking about fundraising, so what we started to do last year and this year is we're doing barbecue plates. And we did it again this year, a couple months ago, and we raised over $1,200 lunch and dinner, and we'll have another fundraiser in October. And a lot of that money, we do other events besides sports. We just had adaptive egg hunt. We served 200 people, 100 with special needs, and then 100 with their families. And then Halloween carnival and Breakfast with Santa, that a lot of that money goes towards those events. We provide toys for not only the special needs child or adult, but also their siblings. And we have a train that comes out and a snow machine. We just try to make it very nice for the special needs kids, because those are the only events that they really get to attend. So that's what some of the fundraiser money goes to.
The barbecue plate, let us know.
So that's one thing we are working on. I had a death in the family, and Charlotte had some issues in her family. So we weren't able to go to business that we wanted to do this year. But in October, we're planning on to hit businesses more. We did offer if you order more than 10 plates, we will deliver to you. So we are hoping to hit more business. Past couple of months, we haven't.
We're also participating in the Hyperdrive Fest, Auto Fest here on June 1st. We will have a booth there, and the salon here in town, Golden Hour, is offering free haircuts to Selma Unified kids, and they are also having a place set aside for special needs kids as well.
That's awesome. I just want to say I see ESYN in the community continuously when I was coaching soccer. Some of the participant or the members of ESYN are there cheering on their siblings that are on the teams, and it's cool because they go home and practice with them. They have a connection with their siblings. While they might not, the parents aren't comfortable maybe putting them in the program with their siblings, they also have a program where they can all develop their skills. So it's amazing to have. And I appreciate you both for doing that.
Also with our soccer and other events, we get the peer tutors from Selma High and the leadership kids from the middle school, and they come out during these events that we're asking you to help pay for to be their peer buddy. So it's not the parents out there, so they have that connection with.
Just a quick question too, just for everybody's sanity, of course. When all these the numbers of registrations that come through here, is that about an average of people, participants, or does it usually get used up and then you're like, well, there was only a certain amount and then?
So far, we haven't gone over the amount. We just kind of guesstimate from the previous year. So my question was, I'm glad you brought that up. So let's say for soccer, we had 20 people that participated instead of 25, but on bowling, we had 35. Could we use some of that soccer money to go towards the bowling registration, but not to exceed the $4,975 that we asked for? Are we able to move around money?
Yes.
I think as long as you come back and let us know, hey, this is what the $4,975 was
We
used for
do,
specifically.
I give a list, the names, the addresses to Leticia. Every time the registration closes, I give her the list. Tell her how many people, addresses and all
Oh,
that.
that's more than adequate.
Okay.
Yes.
Okay.
No, good job with the fundraiser. I know that was an issue before.
Yes.
And you guys ran with it. Yeah, thanks. So you did mention this money is allocated for Selma residents, but you also have other children from other areas. Are they funding their own or your?
We have gone to Kingsburg and they give us a grant through their Tri-County Health Board. So they do take care of the Kingsburg residents, and then the other residents, non-residents, they pay out of their pocket. If we do have money left over from our fundraiser, then we will give scholarships to the families that need help, because we do have multiple families that have more than one kid. And so if we see that they need help, well, we always tell all the families, if you need a scholarship, please reach out. And then no family is ever turned away. So they're always taken care of.
Alrighty.
Thank you.
Is there any other input from the board or from the public? All right, I'll entertain a motion.
I'll make a motion to award the $4,975.
Is there a second?
I'll second.
Moved and seconded to award the $4,975 to ESYN.
Rosemary Alanis,
Yes.
Bardo,
Yes.
Yes.
Avalos,
Yes.
and Matthew Rodriguez.
Yes.
Yes, thank you.
Moving on to the next item, requested initiative by Vice Chair Avalos to help fix/install a new electric door opener at the senior center in the amount of $3,000. Just so we know, the $3,000 is an average that I kind of just looked up what the devices would cost. So
Okay. Mayor Robertson, they installed the door already, the door opener. Okay, how much was it? No, by chance?
Oh.
Oh, okay. Yeah, cause then what we can do maybe is meet halfway, like the city pays half, we pay half. Okay, cause, oh, all right, cause yeah, Jerome, when we started talking about this, Jerome right away said, oh, well, that they had money allocated for that. So I just, I hadn't spoken with him anymore. And so I was just wondering to see how much it was, and then from there we can, allocate some money.
The automatic door for the senior center was not part of that budget, was not brought up. Doesn't mean it's not in it, but I'm just saying it wasn't specifically addressed. So it might be worth an email to Liz to ask her how much that cost, because I know they installed it. I remember when I remember when the public works director installed it.
Yeah, because when I went and had lunch there, I mean, myself as being a senior, I even had a little bit of hard time getting the door open. So I can just imagine how hard it was for some of the people that were there that I knew of that were lots older than me. They had a hard time. Having to go through there with a walker was near impossible. You had to have somebody open the door for them to get them through. So an automatic door opener would have been so much better for them, which, I had talked to Jerome about. And so as far as I know, it's installed. I just got to find out how much and then go from there to see how much, we can contribute.
Might I suggest that maybe the senior center, once they look into the cost, if they could submit maybe a
Invoice.
proposal or an application setting forth how much it costs?
Okay.
I think that would be great
Mhm.
information
Okay,
for the
I'll
board
ask
to have.
them.
Yeah. Yeah, if this was still broken, maybe purchasing the deal would have been good, but if it's already installed, that makes sense to do
Yeah,
that.
it's already installed.
The automatic opener is already installed?
Yes, it's
Oh,
in
so
already.
you're just wanting to help with funding it?
Yeah, help fund it, yes.
Who funded it or who funded it to this point?
It probably
If it's
would have
already
been the
installed.
city. Probably would have been the city. I'm
I
assuming.
mean, does the city need help funding it if it's? That's what I'm thinking.
No, it's installed. It's
Yeah.
up and running. The
It's
door is on, but
Yeah,
she's
Oh.
asking to see if we could help pay
yeah,
some of
help
that
pay for
cost.
it. Because it's our seniors that are there.
Yeah.
In fact, the day that I had lunch there was a gentleman that fell outside there that day. So I just want to make sure, things are safer for everybody all around there like that.
I just want to say that I have actually been there to have lunch at the senior center, and it is difficult for them. I think what might have happened, if I understood correctly, they were looking at for both doors, the senior center and the city hall, because you have the same problem with some of the seniors opening this door. So that they're planning on installing one here. So what they might have did is allowed the seniors to go first and let them, because the seniors go every day. There's a lot of them, a lot of seniors that attend the senior citizen for their, the senior center for their lunch. And here, well, they just decided probably to wait, but I'm positive that I heard them saying they were gonna also put one here. So maybe they just switched it off. I don't know, but I think that's a great idea too, to help them. I was there when they fell as well, so very unfortunate, but they do have a really good time. And I think there's a video out when they opened it up and they were so grateful. I'm very happy for those seniors when they had that door installed, and it did help them a lot. Thank you.
I
And
think
so we'll just-
it'd probably be appropriate to go, maybe just follow up with what
Okay.
they're doing there.
I will follow up with it.
To clarify, the fall it wasn't in operation at that time?
I don't
No.
know. I don't know if there was something in the cement that he
It
tripped
just
over
went
or
up.
what. I'm not sure.
Just got
Oh.
put in. The doors just went in like, I don't know, couple of days ago.
Yeah, just
So the fall was before.
Let me clarify that. Actually, I was there the day the gentleman fell, unfortunately. And the senior situation, was, you're old, you shuffle your feet. And that door was very hard to open. I will grant you, you know. And it became, I would say, it became a problem with the seniors. Cause, even if you open the door, you could trip and fall. Cause the door, it, it was a hazard about to happen, really. And it needed to be rectified, for the seniors because, it was a disaster about ready to happen. Even with a wheelchair, emergency or something like this, it was not applicable at the time. So, and I think the issue was try to rectify it right away and come back to I think you had a conversation with Mr. Jerome. So, because, there were some things very serious that when that gentleman fell, it changed the dynamics. It's like any place at work, when someone's sitting there and opens the door and the door doesn't open correctly, and the door was bad, what are you gonna do? You gotta fix it because the liability just went up. And thank God that gentleman that fell, survived and he was okay. Thank God for that. I think I think the ambulance came and took him, and checked him out. So just to give you FY on that issue.
Thank you.
Thank you.
Would anyone else just follow up with
I'll
it?
follow up with it.
Okay. We'll move on from item number 5. Item number 6, request an initiative by Vice Chair Avalos to allocate $5,000 to an in-house program to feed the seniors food to be sourced from local businesses.
While we were there having lunch, the lunch came late and it really wasn't warm. It was kind of on the cooler side, their lunch, because right now, because at the time they had no stove. I don't know, has the stove been installed? Oh, it's been installed. And so we were thinking, okay, to help out our city, along with the seniors, to allocate money to go like once or a week and go and get from surrounding.
Food from like cells,
yeah.
purchase food,
Yeah,
meals.
food from different vendors here
and
in
there would be
Selma.
the city businesses. Or are you also, was this also for the Christian Cafe to feed?
Oh, yeah.
Let's, be on the calendar to feed, the citizens that need to come out and have a meal
Yeah.
at night. Believe the PD does it. A lot of families
hot
do it.
meal. Or at least what, instead of just sandwiches, because there's a lot of homeless and seniors and stuff out there that they don't have hot meals. They get what they can. And then like right now with I had before was the EOC, and they were trucking in the food. And that wasn't, it wasn't warm,
But how many seniors go to the senior center?
a lot. I'd say
roughly?
at least 20, 25, at least 25,
About
and that's
30
daily.
servings. It's roughly,
Yeah.
would say 30 servings. We
Yeah.
always go 5 or 10 over.
And just, have them use this at least once a week and use it until the money runs out.
Input from the board or
Public.
community?
So is this $5,000 for both the seniors and the Christian Cafe? Because Christian Cafe is, and it would be what team, Selma Healthcare District, that's the team for the Selma Healthcare District that, you guys got to go feed, right? So they would put you on a Wednesday. For example, our agency does it quarterly. And we do it in honor of my father and my brother, who we don't go put flowers at the cemetery for, but we do feed the seniors, we feed homeless people, we feed people with.
But who wants to come and have a meal?
We don't, there's no questions asked. It's every Wednesday right here at Christian Cafe. And it's could get pricey. So we do it 4 times a year quarterly. And we are a team. Our team is the Gallardo family, Robertson Guerra family. And we go feed and it's 60 people. We're looking at 60 people. And for the seniors, I think it would be nice if they could choose, the restaurant, but the seniors eat every day. So depending on how you allocate it for the seniors, because they eat every day there. But for Christian Cafe, maybe, I know they lost some teams. PD does it, Fire does it. We have other families that do it in honor of the memory of their family members. I know Waste Management used to do it, but they're no longer our
Mobile.
trash carrier, so they lost a slot. So I don't know how many slots they lost, but you guys would actually, since it would come from you guys would actually be the Selma Healthcare District team to serve that whatever day you guys, they put you under. But it's like 4 times a year, or 2 times a year, depending on what slot they put you guys in. It's for the Selma Healthcare District. But I just wanted, because we've been doing it for over 8 years now, or plus, something like that. But that I just wanted to make sure we understood the difference between the Christian cafes, only Wednesday nights, every Wednesday night from 6. Maybe they do, maybe it's over
Hour and a half.
an hour and a half too, but if you have kids or anybody who needs community service, they could come help you. And they'll get community service to help serve and clean up and do all that as well. So it's a great program. So hopefully we could feed some people out there we've sat with some of them and you could tell they really need that meal for that night. So it's very positive for our community. Thank you.
Not only feeding, it's also their, I want to say their soul, because they're talking with people. So they're socializing and it's improving their mental well-being.
The comment I have is, I think today's meeting is kind of a introduction of kind of like what you would like to see. But I think it's kind of premature to take a vote on it right now, because you talked about the homeless and then we're talking about the Christian Cafe and the senior center, all good causes, all feed, but how are we going to allocate it? And then make sure that it gets allocated in the way that we
you
would
would-
like it to go.
You'd purchase it and then you turn the receipts in and we pay them.
Right.
Or they say we order from sales. We have Carl, here's
Yeah.
how many
'Cause
servings
I've
we
already
need.
checked into a couple
I
of
write 'em a
restaurants to
check.
see what kind of a deal they could give me for the seniors, okay? And that was it. The Christian Cafe, that one just came up when we're talking about that. But my original thing was with the seniors.
So, Mayor had mentioned that, the reason for the cold meals was they didn't have a stove for a while, correct? But
Quite a
they do
while.
now. So do they need our money? Because they have food already. Do they
Yeah,
need
but it would still be a nice treat for them.
just a restaurant, kind of a
Yes.
restaurant?
Yes. I mean, because I've already talked to Las Estrellas, I've talked to Curry Taco, I've talked to a pizza already. So, I mean, I'm just gathering information to see how much they would charge for about 30 people.
Would that be an ad hoc that would put together a proposal?
I think you could probably handle it a couple of different ways, but I do think it'd probably be a good idea to maybe put together, whether it's fashioned as like a program, an initiative statement or a program guideline that sets forth, the process and what's going to be included in the initiative. Because it sounds like there's a need, and it sounds like, there's potential $5,000 amount would be enough, but if it's set forth in a policy document or a program statement, then it would be really clear, where that money is going, when, on what days, or what programs. That's something for the
Yeah.
board to consider.
It would all be shown where it goes, every penny that gets spent or what. what is being provided and how much it costs and how many servings, that's not a problem.
So, before we vote on it, okay. Because like, all this started before they got their stove. But they have their stove now, and yes, they
Okay,
do
so
get
then
the-
who's gonna make contact with Christian Cafe to see when there's an opening to see, or you want them, you want the seniors to provide, um, um, a script of what they want to eat and how many meals and what it's gonna cost, and then bring it back to the board?
No, just like, I would suggest an ad hoc, like Lorraine and then maybe yourself, put this program together, and if it includes the Christian Cafe, homeless, seniors, put it together as a program.
And then
and then we
would the
can vote on it.
board be willing to go help serve? Because like, this would be this would be United Health Day to
You,
serve.
you don't need to be there. They have servers too as well. I mean, if you can't make it, it's one night.
Yeah, it's one night. But it would put us out there as a board, showing the good that we're doing.
I have a quick question, not a question, but, this is strictly for singers or is it for both Christian Cafe?
Both.
Both, okay. You know, I understand there's a budget and you guys need to work with, but this is you're talking about singers, you're talking about veterans. They've already put in their time. They've already worked their whole lives. They deserve a nice hot meal. As a person who works in food services, there's nothing like feeding somebody and seeing their smile on their face. You know, they say, thank you, have a good day. That just brightens up your day. And if you guys come together and you do this for them, trust me, they'll really appreciate it. Not only that, but you guys, a lot of people don't know about the health board. I didn't even know about the health board until I started getting involved with the city. So this will also give you guys another platform to, out there for the city. So, yeah, thank you.
Thank you. So should we put it ad hoc then?
Yeah.
Yes.
Okay.
Yeah, and I don't think the document needs to be too complex, just
Yeah,
a
no.
program statement
Sure.
setting forth.
Yeah,
We'll
we've
go
had a
on.
similar one before during COVID to
Sure.
send meals out.
Oh,
So I
well,
mean, it
maybe
could
there's
probably
some-
go almost the same way as that one. Yeah.
Sounds like there's a need and it sounds like something the board
Yeah.
would like to support.
But that one was pretty broad because of
Yeah,
COVID.
that was. an
It was
emergency,
50,000
like, allocated funds
for,
to a certain
for
initiative.
masks and delivering meals to the seniors, which it was a great program because everybody was locked down at home. So I know my wife and I were a part of that along with a lot of other people that were out delivering. We had a route and delivered meals to the seniors who couldn't leave their
Yeah.
house.
Mhm.
So, and they are very
That was a lot more
appreciative.
complex than this one.
Right, but it was real vague.
Yes.
It was just real vague, 50,000 cap. There you go for meals and masks.
Well,
I
this-
think we purchased masks.
So we've done something similar. Probably that one was probably a lot more complex. So it's pretty, I think we'll be able to do something like that. So. Yes, exactly.
Okay, that's a
Um,
good idea.
Did we have a comment before?
Yes, if I could provide some advice, I'd be happy. If this is something that you guys are interested in moving forward with, my staff and I oversee the senior center. And so if you guys would like any advice on how to move forward with this, we'd be happy to help. Right now, on average, we serve about 30 seniors a day. Once we start implementing restaurant food, I can guarantee that number's gonna skyrocket even more. And so, the meal that they receive right now is pre-prepared. It comes from Fresno EOC in hot containers. We just serve it up at this point. It's not the greatest of meals. It's definitely more on the nutritional side to meet their needs for their well-being, but they really do enjoy the restaurant food. So if you do decide to go that route, I know that when we host dances, typically we like to cater out. And at this time, normally, let's say that for our Valentine's Day dance, I charge about $10 per person, but that's because we go out and we purchase a restaurant meal. And so that helps cover the cost of the meal. And so there's different ways to go about it. So if you guys need any advice, if you guys would like to further discuss this, I'd be happy to work with you on that. If, again, this is something that you guys intend on doing in the future. So there's ways to go about it.
Okay.
Yes.
Awesome. Thank you.
Wait a minute.
The doors.
The doors,
We gotta go back
the
to that.
doors, and the push
Right.
button door.
Lorraine. let me finish and I'll go. we'll
Oh,
go
I'm
back to
sorry.
that
Okay,
item.
I'm sorry.
So just for the sake of this item, you would like to,
Do an ad
do an
hoc.
ad hoc, you and Letitia,
Mhm.
to, basically come up with the,
Info,
the well, I guess the information or just the initiative, deal to come back to us.
Proposal, yeah.
Um, I feel like there's enough items to almost need a, what do we call it, a special meeting before our next one. Well, I guess we'll talk about that when we get to the next meeting deal. But, I foresee us doing this a lot quicker than July. Just, okay, so with that, item 6 is, being resolved. Is there any objection to going back to item number 5 to ask a question? Okay. Liz, we had a question for you.
Okay. With the electric door opener, okay, when was it installed?
That was installed last Thursday. That would be the 17th, April 17th.
Okay, do you know how much it was?
Unfortunately, I do not. That was something that the Public Works Department oversees as they oversee facilities, so I did not receive any of the billing information for that.
Okay, I just need to find out how much it cost.
I can possibly get that information for you, but for facilities, that would be directed towards our Public Works Director, Michael Hahn.
Got that.
Thank you.
Okay, perfect. Thank you. I apologize. We're hosting Earth Day across the street,
Okay.
so
Go ahead.
going back and forth today.
Yeah,
So
I
we're
believe
about
that is
done.
all we got. Thank you. We'll move on. So we're gonna, forego the closed session item. And then, I guess there's no item on here for future agenda items, but, would I be able to ask you at this time, how to word that?
So just to be clear, there's not going to be a closed session item today.
No.
And so that closed session will not be happening. Now the question is about future agenda for a special meeting?
Yes.
I think it's fine for the board to discuss potential availability for a special meeting if you think it's going to be needed.
Okay.
Otherwise, it looks like the next meeting is currently set for July 17th.
Yeah. I just know that the swim program is definitely going to start well before that. And we also have this door deal that probably information will be relevant at that time or as soon as we can. And then that food initiative could start, a lot quicker than the July 17th date. Have to
What I'd recommend is just.
look for a different date.
You can collect availability, and then I would direct Debbie to finalize that and do the proper noticing for that meeting.
Okay, yeah, so the goal would probably be within, well, what is it, no less than 5, no more than 5. You said it was gonna take about 5 weeks to get guards, correct? For that program, if I remember correctly? She's gone, but
Yeah.
I don't wanna have that meeting and then her still say, we're really close to doing that, or try to set a date. So I guess 6 weeks from now is. That's a first Tuesday, so we couldn't do that. City councils are first and third Tuesdays, correct?
First Tuesday.
So we could do either the 27th of May, which is a little close, June 10th or June 24th. Either the.
Is that what you put?
Well,
No, ideally June 10th is probably the best day for that.
Okay.
Because it's right after school lets out,
No
Yeah.
or right
graduation.
before, I'm not sure.
But if we have,
will we
is this
decide
for
that
a
today or
special
have
meeting or regular meeting?
Special.
special? Because our regular meeting is on
But
the
if, say
17th.
she makes contact with you and she gets the lifeguard, maybe then we should move as soon as possible, as soon as they get somebody.
Yeah, there's also the other items that we would find out too. So I guess the last,
Well,
the
you
very
can call a
latest.
special meeting.
Mhm.
Okay.
Okay. So then potentially is June 10th potentially a good day?
June 10th.
Okay, what day?
June 10th.
No, I can't make it. I'm sorry.
Okay, well,
Okay. Um,
we can
Why
still
don't you
have a
just have
special
Debbie
meeting.
send a
If
doodle
there's a,
invite?
well, I guess
need 3
the
board
June 10th
members for
day
a
is
meeting.
just so that we can, so if it so happens to come before and the lifeguards are available, I mean, I'd probably ask everybody right beforehand, say, hey, everything's in place, we should do this like as soon as we can. So it might come before that, but that's as far as I'd want to go before, so that we can do the other items as well. That would be at the latest. Don't see,
We can stick with June 10.
yeah,
If
so
we
June
change it,
10th
we'll
would just
change
be the
it.
latest date. If all that information comes together beforehand and there's a day before that we could do, we'll just have Debbie do a doodle for everybody and see if we can make another Tuesday. And then, okay. Alrighty. Well, we'll do a doodle for the beforehand, and then I'll follow up with Liz and ask her about the, like, how close they are to getting those guards and stuff, and I know a lot of guards too. I have a few in the valley, so. Alrighty. Other than that, I mean, I usually ask for agenda items before the next regular meeting as well. It's not on here, but I mean, I'll entertain them right now, I guess.
I would just like to make a comment before we close. This is our bylaws that I got off the website. So I just wanted everybody to understand everybody's interpretation of healthcare is different. Absolutely. But our bylaws, our mission statement says healthcare is delivered by health professionals and allied health fields, medicine, dentistry, pharmacy, midwifery, nursing, optometry, audiology, psychology, occupational therapy, physical therapy, athletic training, and other health professionals all constitute healthcare. That's in our mission statement. So like Mrs. Robertson said and Letitia said, yeah, it's all an interpretation. But if you want to put on the healthcare agenda, I'm asking that we bring somebody in as an independent auditor to make sure that we're following healthcare protocol
According to who?
according to our bylaws, according to the Association of Healthcare Districts.
So. I'd
That's what
like,
I'm asking. You don't have to do it, but I'm
Don't need
asking
that. I don't think we need that. We were elected to sit up here, and it's our votes where the money goes.
Yeah,
Because I know before it was with the hospital. They were with the hospital. We're no longer with the hospital.
That's our
Haven't
mission
been with
statement.
the
I'm just
hospital.
reading you what our mission statement is. Yeah,
That when we were with the hospital.
that is our mission statement. If we want to change it, we would have to change it.
yeah. So if we, our current mission statement right now is pretty restrictive in the terms of healthcare, because healthcare is a pretty broad statement, like you said. And a lot of people are gonna have different opinions on what it is. Because if you look it up as a broad general term, it's efforts made to maintain, restore, promote someone's physical, mental, emotional well-being, especially when performed by trained and licensed professionals. Especially is the gray area. Also, efforts made to maintain. So we could say healthcare is running. We could say healthcare is anything, almost. That's what us 5 members were, voted on by our constituents to come up here and deliberate
Mhm.
where the money that they are paying into is to go. I'll just put it this way. What I do when I come up here is think about the people that I'm representing, the money that they're paying in, and am I willing to go say, hey, you're paying $55 of your taxes this year, and this is what we're spending it on. Am I comfortable telling them that? So that when I'm voting, that's what's in my head. If I know that they're comfortable, my constituents are comfortable with that, then I'm sound-minded. And I mean, everybody's situation is gonna be different,
Mhm.
every single one of us.
Absolutely.
So, I mean, there's gonna be, and 100%, or not 100%, but I guarantee you, there's gonna be times when we all 100% disagree with each other. And there's gonna be, all that. However, that mission statement right now, there's gonna be some proposals that come, or grants that come up that I think we should still support, or another member might want to support and I don't. So maybe as a board, with I believe we have a running ad hoc with me and Anthony to to look at our bylaws and see. And that was one of the things that we had brought up. We just, we haven't necessarily nailed down the complete revisement, just because it's a difficult thing to put out to get everybody to encompass everybody's ideas, because, I mean, we're all individuals.
That's why we don't we belong to the Healthcare District Association?
Special District
Special
Association.
District Association. So maybe we should look at their bylaws and see what they say, or have somebody from,
SDRMA.
yeah, come in and say, okay, this is good, or you need to tweak this, or whatever like that. Some of the stuff that we've spent money on in the past makes me extremely uncomfortable. And I'm sure that if it was made public, it would make people feel uncomfortable.
It's public.
He said he didn't even know there was a
So
healthcare board.
you're one board member, there's
And I
5,
have an opinion.
and so do I.
Okay,
And
and that's wonderful.
there is a lot of need here
There
in
is,
our city for our nonprofits. Our
Absolutely.
nonprofits, doesn't matter who they are.
Absolutely.
There's tons, from kids all the way up to the seniors and everything in between. And if they're asking for funding from us, it is our right to hear them, and
It
it's
is.
our right to vote
It
if
is
they
our
get
right.
allocated the money. It's just that simple.
It's your opinion, my opinion.
Is it, okay, well
Okay.
then, it is what it is.
I
So what's
I
the
just
problem?
have, I understand your point of view, but we have to also look at, there's a law that guides us. Because our mission statement is unique to just our board, but it can
Yeah.
be changed. But the law that we have to follow for the healthcare district, we cannot change that.
It's
So
much more
there's
relaxed than ours.
certain things that we can't give, hold on, just one sec,
Hold
just
on,
one
hold
sec.
on. Let me
There's-
let him have his time, and then we.
There's
go back.
just certain things that we can't give money to, even though it's a good social program or a feel good, we want to do it for the community. There is a law that kind of limits what we can do. That's what I'm saying.
For the remainder, I just want to let everybody know, for the remainder discussion, I want to make sure that whoever's speaking doesn't get interrupted by another board member until they're recognized, so. Mr. Ring.
Okay.
Okay.
Yes.
Thought we were.
Well, at the end of the deal, there's usually, like a report, and it was an agenda item requested for information, I guess it's a discussion on that item. Is that? Yeah. As an item. Okay, then at this time, then I'll ask, what is the specific item name that you'd like to go on the agenda?
Me? I would like,
I would ask legal counsel how you'd want to
how do
phrase
I-
it. Because it would be, what you're asking is to amend, or
Not
either
amend.
not amend, or
Review.
review
Review?
our mission statement. Do the mission statement and the guidelines for funding initiatives.
okay, or have a
There's no
discussion
need if
about
you just-
that, correct? Yeah. to have a discussion, it would call it a discussion and review of the mission statement? Yeah, it'd be just, yeah. That's the goal for your item, yeah.
Thank you.
So discussion and review of board mission statement. Are there any other future agenda items from the board?
Oh, the closed session that was gonna be, is that
Yeah,
gonna be
that's,
next?
that's, I was just at, yeah. So the closed session item, I was gonna ask how we should word it. The intent behind it is, right now, our administrative secretary is interim administrative secretary. And, the intention of the item was to basically just, go about how do we,
I'm happy to provide the language. In the Brown Act, there's something called safe harbor language when it comes to closed session items. And so the language itself is provided in the statute. And so it's not just a copy and paste of that language. You need to make sure that it's the appropriate closed session item. So I'm happy to work with either you or Debbie, whoever's preparing the agenda, to make sure we get the proper language on the agenda for it.
okay, yeah, well, we'll probably both reach out and be CC'd on that, but
Yeah, it's.
I'll reach out and ask about it.
Sure.
Okay. Any other items? Alrighty, is there any opposition to adjourning?
And a public comment.
Oh, we had a public
Yeah.
comment?
Stellar, Marisol, California. You know, this is bringing back memories from former council, how there was no transparency when there was the 3 council members were on board, when it's still. But I just want to say that you're selected by the citizens of the citizens of Selma to be up there and to represent us. We pay our taxes, like Mrs. Robertson said, and transparency and honesty is very important. And as taxpayers, we do deserve to know where our tax dollars are going. So, it's important, very important to be transparent when you're up there. And that's just what I want to say. I know I speak for myself, and I know that I speak for many people here from Selma. So please be transparent and please be honest with the citizens of Selma, because you are up there, you were appointed up there by us. Thank you.
Thank you.
Any other last minute comments from the public? All right, with that, is there any objection to adjourning or
I make a motion to adjourn.
objection? Adjourn.
Oh,
It's,
do I have a second?
there's no objection.
Okay, sorry.
So,
Sorry.
Meeting done.
Yes.